Hello, I'm Dr. Alexandre Amato, a vascular surgeon at the Amato Institute. Today I'll discuss the post-operative period in lipedema surgery, specifically liposuction of the legs and limbs, and starting by saying that we perform the surgery with both teams, the vascular surgery team along with the plastic surgery team. We understand that it is a procedure that, when done by both teams, aims to protect the lymphatic system, as well as also the resolution of the fat disease problem, and always also aiming for an aesthetic result. The issue is that often the surgery, in seeking to resolve the inflammatory symptoms, may not achieve the desired aesthetic result. I'm not saying it will look bad, that's not it. I'm saying that the pursuit of an aesthetic result sometimes conflicts with the pursuit of symptomatic improvement because the areas to be treated are different. So there are various strategies for treating lipedema regarding the areas chosen to be treated. This must be done following the protocols. There are protocols for the areas to be treated, obviously not just with consent, but also considering what the patient wants. But this needs to be well discussed because areas that might offer better aesthetics may not provide any symptomatic relief. Well, once the surgery is done, surgery performed with local anesthesia and sedation, you won't be hospitalized. It's a day hospital procedure. Compression garments should be used, elastic stockings to maintain this compression on the skin surface and prevent the formation of seromas. So this elastic stocking, this elastocompression, it will need to be worn in the days following the surgery. Obviously, with each passing day, this need decreases, but right after surgery, the first week is essential. In your second week, you can reduce the usage time a bit, and so on, sequentially. So the use of elastocompression is extremely important. It should be chosen and acquired before the surgery. And the formation of bruises in patients with edema can occur even with the use of elastocompression. So those with lipedema already know there's an increase in the formation of bruises on the leg very frequently. This elastic compression helps reduce this, but it also doesn't eliminate it completely. So it may be necessary to apply creams to prevent the formation and or speed up the absorption of these bruises. Another important aspect to consider is the use of warm compresses, which can be highly beneficial. Early ambulation is also crucial to minimize the risk of developing a thrombus. Therefore, remaining active is key instead of staying sedentary. This active approach is integral to the post-surgery recovery process. In the event that a follow-up procedure is planned, it can typically be scheduled for 1 month after the initial surgery. Thus, the question arises, is it imperative to proceed with the second procedure at that specific juncture? No, it can be done later, but the recovery time is shorter, if done within that period. So you have the surgery, the first surgery, and if you need a second liposuction session, it can be done 1 month after the first. And similarly, if there are others, you can consider this approach regarding thigh lift surgery, which is the reduction of excess skin. It is a procedure that will never be done in the first event. It can be done along with another session, but never with the first. And it can be a procedure performed separately. All of this will be evaluated together with the plastic surgeon, and the best timing and the necessity will be discussed. We never suggest doing multiple procedures together. For example, the while we're at it scenario, let's do liposuction, let's also do breasts and also an eyelid surgery. Combining procedures increases the risk. So whenever possible, do one procedure at a time. This reduces the risk and increases the chance of success. Regarding the use of medication in the postoperative period. Anti-inflammatory medication and painkillers will be prescribed, all aimed at controlling any possible and eventual pain. It is necessary to undergo clinical treatment for lipedema, which will be discussed during the consultation, as it not only reduces the inflammatory reaction to surgical treatment, but also helps prevent the progression of the disease. All of this will be discussed during your consultation with the doctor. If you have any questions, we are here to answer them. If you liked our video, share it, subscribe to our channel, click the bell, and see you next time.